Hi everybody, I'm Dr. Sarah, staff veterinarian for Life's Abundance, and in this episode of Pet Talk, we'll be covering Canine Vestibular Disease, or CVD for short. CVD is a condition usually seen in older dogs, and with more dogs than ever living past retirement age, it's wise to be aware of this condition. Of all the conditions that veterinarians regularly encounter, there are few that can really scare the pants off of pet parents like canine vestibular disease. Fortunately, even though the symptoms can be striking, CVD is generally not a serious long-term problem. The onset of symptoms of CVD is usually rapid and quite dramatic. Dogs who develop CVD usually exhibit some or all of the following symptoms: a sudden loss of balance, a persistent tilt of their head to one side, like they are looking at you inquisitively or listening to some distant sound. They can also have twitching of the eyes, usually to one side, and they can have vomiting and appetite loss due to motion sickness. Veterinarians have compared CVD in canines to vertigo in humans. Just like in vertigo, in CVD, a dog's eyes twitch back and forth over and over again, usually to one side. That's a condition we call nystagmus. To a dog afflicted with CVD, the world is literally spinning out of control. Have you ever made yourself dizzy by turning around in a circle for 20 seconds or so? You'll recall that the initial spinning feeling slowly fades away after a few seconds of stopping. But for a dog suffering from CVD, the spinning sensation can last for days. The symptoms of CVD can be so dramatic, so frightening, that many pet parents actually fear for their dogs' lives and rush them off to the nearest veterinary hospital. In most of the cases I've seen, however, I've been able to reassure distraught pet parents that the symptoms will pass and normal life will resume very soon. The treatment for CVD is usually supportive in nature. Most canines can be treated at home with motion sickness medication, feeding by hand, loads of TLC, and tincture of thyme. But if a dog is vomiting repeatedly or already in a medically fragile state, hospitalization and intravenous fluid therapy may be indicated. We have yet to determine the cause or causes of CVD. Current causal explanations range from mini strokes to acute inner ear inflammation. Every once in a while, I will see a dog whose health has been in steady decline over some time, and an episode of CVD signals something more serious, like a serious inner ear infection or a brain tumor. Thankfully, for the majority of our furry friends, this isn't the case, and symptoms are relatively short-lived and will clear up over time. Of course, if you think your dog might have CVD, you should always take them in to see your local veterinarian for an examination. Thank you so much for watching, and please check back next month for another episode of Pet Talk with Dr. Sarah.